therapist. Now, viewing ADHD as this neurogenetic or neurobiologic disorder of self-regulation brings with it some very important insights I would want you and families who I counsel to understand, not the least of which is this one. This is ADHD writ large. It's always now. ADHD is, to summarize it in a single phrase, time blindness. People with ADHD cannot deal with time, and that includes looking back to look ahead to get ready for what's coming at you. So the individual with ADHD is kind of living in the now, and wherever the now goes, they are being pulled along by the nose, wherever it goes. I'll give you an example from our adults clinic. It's rather funny, but it wasn't to his wife. This couple came into our office in Massachusetts once, and she said, "Let me tell you what it's like living with this guy, because it's like having a fourth child, actually. This is what happened last weekend." She says, "If you can't do something about this, I'm leaving him." Here's what happened. He went out to mow the yard. He wheeled the lawnmower out of the garage, and the tank was empty. So he reached for the fuel can. It was empty, too. So he threw it in the back of the Ford Explorer and headed down to the little Quickie Mart. And while he was filling up the gas can, his buddy pulls in his Ford Explorer and says, "You know it's opening day on the trout stream. What do you say we go fish a little bit?" And so the guy hops in his buddy's Explorer, and they go fly fishing. And they are out for 6 hours. And then they get thirsty and decide to stop off at a pub for a beer. So now they're at the little local tavern. This is a true story, by the way, because within an hour, the state police had found his car still running in an open gas can at the Quickie Mart. And he finally wandered home at 4 o'clock in the afternoon. Do you see what happens? Doesn't matter what your plans were, what your goals were. The now is more compelling than the information you're holding in mind. And you will get pulled along by the now. You are time blind. Because if we had to summarize in a single sentence, what is the purpose of the frontal lobe to humans? It is to organize your behavior across time in anticipation of what is coming at you, the future. So ADHD creates a blindness to time, or technically, to be more accurate, a nearsightedness to the future.
Can you say that again?
I can only be eloquent once. No. This is extemporaneous. I'm not. Okay, ADHD, right, is at its heart a blindness to time, or technically, to be exact, it is a nearsightedness to the future. Just as people who are nearsighted can only read things close at hand, people with ADHD can only deal with things near in time. The further out the event lies, the less they are capable of dealing with it. And this is why everything is left to the last minute, because they only deal with last minutes. That's all they perceive, that's all they deal with, that's all they organize to. And so their life is a series of one crisis after another, all of which were avoidable because people prepared. And they didn't. They weren't ready on time, in time, over time, with what they needed at that time. Note the word time. So ADHD is destroying the timing and timeliness of human behavior. That is a very important thing for parents to understand. Because while a 3-year-old does not have to have a sense of time, a 30-year-old does. And one of the most devastating deficits in adult life that ADHD produces is a disruption in the fabric of time. They can't cope with it as well as others. Now, this ability to organize across time comes with the capacity to build pyramids of behavior, from little behaviors to the bigger behaviors above them to the bigger goals above them. All human behavior can be organized into a hierarchy. Think about planning a wedding. Can you imagine the hierarchy you would have to create? The decision trees, and when they would have to be done, and when you would have to book the church and get the minister and get the flowers and book the reception hall. And all of those come with little subroutines like picking up a telephone and calling your minister, right? It's the frontal lobe that allows you to organize all of those toward the single overarching purpose, the wedding. And that's what ADHD destroys. People with ADHD cannot hierarchically organize behavior. And so they are accustomed to dealing with behaviors in little fits and starts. But they can't glue those together as well as others to create the bigger goal to the bigger goal all the way up. And that's why you see a short attention span. It's not really a short attention span. It's the inability to organize behavior across time into a hierarchy. The ability to look ahead is called intention. So ADHD is actually IDD. It's intention deficit disorder, because it doesn't matter what your intentions are, you're not going to do them. So, you can head out the door for school in the morning and promise your mother that you will not be put in timeout again. You really will get it right today. You will behave yourself. You will not fight with the other kids. You will finish your work, and you mean it sincerely. But within an hour, your mother's getting the usual call that you're in timeout and that you're disruptive and they need to come and get you, right? Notice what happens. Your intentions are not the problem, and it's not insincerity. It's the inability to organize around those intentions. So ADD is really IDD. Now, I want you to understand something. Your brain can be split into two pieces. The back part is where you acquire knowledge. The front part is where you use it. The back part is knowledge. The front part is performance. ADHD, like a meat cleaver, just split your brain in half. So it doesn't matter what you know. You won't use it. You have what we call in psychology a performance disorder. Performance disorders have nothing to do with skill. You have all the skills other people your age possess, but you can't use them. Because you see, it's the executive system where the rubber meets the road, where what you know gets applied in every day what you do. And ADHD is a disorder of doing what you know. It is not a disorder of knowing what to do. And that is a very important thing I want families to understand as well. Your child, unless they were raised in a zoo or in a very impoverished area or were adopted out of some far-fetched, war-torn, undeveloped country, has all the information and knowledge that the other kids their age have. What they can't do is use it. It is the application of what you know that this disorder robs you of. So you can be the smartest person on the planet, and you're still going to do some pretty stupid things. Because it's not what you know, it's doing it. So I would want parents to understand that that is a very profound disturbance in a person's behavior. But it arises out of neurology and genetics, and out of this is going to come a very important view of what to do about this disorder. The first thing this is going to mean is to stop teaching so many damn skills. Because you're approaching this child as if he's stupid, right? Oh, he doesn't have any friends. I guess he doesn't know social skills, so we'll take him down to the local clinic and we'll enroll him in a 12-week social skills camp, about which we'll probably pay $50 to $100 a session. Or we'll send him to the Upper Peninsula of Michigan, where there's a nice summer social skills camp that was advertised in Chad's Attention magazine. There is. It's probably a very nice camp. I don't mean to belittle it. I'm just telling you it will do no good, right? Well, now let's understand something. I might want to send a child to camp just to have fun, right? It's part of the quality of life. Go, have a nice summer. But if I'm sending you to camp with the belief that you're going to come back a person with better social skills, you are sadly mistaken. Right? So we have got to stop putting all the eggs in the skill training basket, because that's not where the problem is. Right? We have got to spend more time changing the point of performance. The point of performance is where you should be using what you know, and you're not. And the only way to treat a performance disorder is to change that point. This means that all treatment, if it is going to work at all, must be at the point of performance, the place in your life where you're not using what you already know. And if the intervention isn't done there, it's useless. That has been a major finding of the last decade. The only treatments that work are treatments that modify those natural points in the environment where the problems are occurring. And if those aren't modified, nothing done away from that site will do anything. So you can do pull-out services, you can go to summer or to social skills camps, you can go to special ed, you can come and see me for once a week for psychotherapy. And everything I just said will have no generalization or maintenance. Won't go anywhere, won't even leave this room. Howard Abakoff tells a beautiful story of the social skills group he ran, and on the day they covered anger management and sharing, he opened the door to the room and there was a fist fight in the hall by the elevator over who was going to push the button. So much for your Anger management, right? You see what happens? You were focusing on knowledge. Oh, let me teach you how to share and cooperate. And you miss the point. This is not information deficit disorder. Right? This is performance deficit disorder. So you got to change those points of performance. If he has no friends on the playground, you're going to have to do something at that school. If you got trouble with homework, it's the kitchen table, honey. It's not my office. We need to rearrange where the homework is being done to help them show what they know. As I've already said, this point of view also then makes us look very differently at psychopharmacology as a form of neurogenetic treatment. Now, everything I have just said could be used by any parent to come up to me and say, my child got thrown out of school yesterday for some misbehavior. Would you please go to school and get him reinstated? He should not be held accountable for these consequences, right? Because after all, didn't you just say it's a neurogenetic disorder? So let me help you understand something about what I've just said. ADHD does not cause a problem with consequences. The problem is with time. It was the delay to the consequence that disabled you. Which means that I'm going to do the opposite of what this mother is asking. Increase accountability, not decrease it. Increase the frequency, immediacy, the salience, and the timing of consequences. People with ADHD need more accountability, not no accountability. In fact, this view of ADHD as an executive disorder would tell you that if you argue for no accountability, you will make this disorder worse, not better. Because the problem is the delay, and all natural consequences of any importance are delayed. What does that mean? We are going to have to use behavioral treatments, the BMOD programs, the tokens, the charts, the cards, the Smurf stickers, whatever. What is their purpose? Their purpose is not to teach. That is a misnomer, if you will. Their purpose is to sprinkle artificial consequences into these delays in the natural environment in order to increase your accountability. So they're not teaching anything. They are making up for the accountability deficit disorder. BMOD does not teach anything to ADHD children, really. What it does is improve the motivation to show what you know. By making you more accountable, more often, around you, you have less ADHD. By excusing you from the consequences, you'll be more ADHD. So I want you to understand something. There are two reasons why we would tell you as a family to do behavior modification. One is instructional. This is why we teach families of autistic and mentally retarded children behavior modification, to teach their children things they don't know. But the second purpose you would do BMOD for has nothing to do with instruction. It's motivational, to make up for the motivation deficit disorder that this disorder produces. And so if you do BMOD for its motivational value, you can't stop it. Because if you pull it, you've pulled the motivation. If you do BMOD for its instructional purpose, you can pull it. Because once they've acquired the skill, they'll use the skill, and you don't have to worry about it anymore. Now, do you see a contrast here? Most parents, and nearly all teachers I deal with, believe that BMOD is for instructional value. That's why we do it for ADHD, which is why whenever you go into a school and you try to teach a teacher to set up a token system, the first question out of his mouth is, how long do I have to do this? When will he internalize the program? And my answer is, never. As long as he's in your class, you will have to arrange artificial consequences to replace the delayed ones. And if you don't do that, he will not work for you. So I want you to think about token systems and star charts and all behavior modification as being equivalent to a ramp that comes into this building. That ramp is there to make people who are physically disabled less motorically impaired. They can get into the building in their wheelchairs or whatever other devices they're using. But would you ever say to such a person, after 30 days of entering this building successfully using the ramp, you know the punchline, right? Can I take the ramp away? Have they internalized the ramp? Well, of course not. The ramp was never for teaching, right? The ramp is a prosthesis. A prosthesis is an artificial means of reducing the disabling consequences of your disorder. It is not to train you up into anything. No amount of using a ramp is going to take the ramp away. And no amount of BMOD is going to take the BMOD away. these individuals will always need more frequent consequences around them than will other people in order to perform at the same level. It's just a general corollary of ADHD. So what else have we learned about ADHD? Well, if all treatment is at that point of performance, and if at that point of performance I'm trying to arrange a prosthesis, a prosthetic environment to reduce the impairment from the disability, right, then it means that the caregivers are the most important people in the treatment plan, the parents and the teachers. It is their compassion for disabled people and their willingness to make these prosthetic accommodations that is the heart of any successful intervention. And absent that compassion, no amount of quality in a good professional or therapist is going to change that. You have to make those people stakeholders. You've got to get them invested. And if they're not, you're in trouble. It doesn't matter how good a clinician you are. So it's best to look at ADHD, I would be telling these families in my office, like we look at diabetes. Largely a chronic disorder, and our goal is to manage it, to create a reduction in the symptoms, the purpose of which is the avoidance of secondary harm. We do not treat diabetes to get rid of it. We treat it to prevent what happens to you if you don't manage your diabetes, because you will go blind, and your heart muscle will atrophy, and you are at risk for sudden death, and you will get gangrene, and you may have your toes or fingers or other appendages eventually amputated if we do not manage your insulin levels. That is what we try to prevent. But no amount of treating diabetes is ever designed to get rid of the diabetes. And I think ADHD is a very good analogy. I think we manage ADHD to prevent the secondary harms, which I'm about to show you. We don't manage ADHD to get rid of it. We manage it so that you don't experience those more heinous consequences.